Hi, I'm Lance DeLange. This video we're going to talk about a common problem with your elbow, commonly referred to as tennis elbow, more specifically lateral epicondylitis. This problem is identified by pain primarily at the base of your elbow. The extensor tendons, as you can see as I wiggle my fingers, these tendons attach on a little bony prominence on the end of your elbow. This is called your lateral epicondyle. Tennis players will commonly get this problem because of the repetitive motion involved in tennis. As you notice as I move my fingers, these tendons are attaching here. Also, as I move my wrist in this position, these tendons are also attaching here, which are pulling on it. This part of the elbow often does not have a great blood supply, in that once this problem develops, it can often develop into a chronic ongoing problem. Tennis elbow is referred to as a tendinitis, where the tendon is upset and irritated. In many cases, to be more accurate, there can be a tendinosis, meaning some degenerative changes that can occur with the tendon, which hence can limit the ability for the body to heal this. So first off, let's talk about the diagnosis for it. Tennis elbow, most commonly you may notice, is you have pain, particularly with certain activities with your hand or wrist. Common problems that may give you difficulty, perhaps you're a typist or you play the piano, something that's repetitively moving the hand is pulling this. You may start noticing an ache or discomfort, and this can be a very intense pain, primarily located at the elbow but extending down the forearm. This is commonly exacerbated by increased activities, although during the time of doing a lot of activity, it may actually calm down and feel better, only to give you more difficulty or grief later on that night. Tennis elbow has a variety of treatments. Simple things such as an anti-inflammatory, such as an ibuprofen or an naproxen, Aleve, many others could give you some relief by working on the cellular level to calm inflammation. There are several stretches that you can do. We will refer you to a therapy video shortly, which can give you a lot of stretches and exercises that could be performed. But for simple things you could start on your own, you could take an anti-inflammatory. Icing it could certainly help. You may find that giving some stretches, and you may try a few different areas and find where you feel you can stretch it best, but loosening up those tendons with stretches before or after your activities can also be helpful. Putting ice directly on it can help to calm it down. Of course, be careful not to cause frostbite. There's a tennis elbow strap. You may see them often with athletes. As you watch different sports, you may see people with a strap coming across the elbow. These can easily be acquired online or your local sporting store. These straps can be placed, which can take some of the stress off as you continue to do these repetitive activities. Where you place this can make a difference. If you're too high, you may irritate. You may cause discomfort over the area and not get the relief. If you're too low, you won't get a proper relief. To find the area, you can put it over the upper forearm and tighten the strap and do some certain activities to see if that gives you relief. If you have this too tight, you could cause problems with the nerve that comes underneath and cause numbness or further pain or discomfort. So you want to be careful not to have it too tight. If you're wondering if you have tennis elbow and you're not sure, a couple quick simple tests you could do to check is find the bony bump on the end of your elbow and push on it with one finger. And if it's very tender there, particularly go just below it, just towards the hand side of the elbow, and push over the softer part of the tendon. If that is very tender, this could be tennis elbow. Another way you could identify is with your arm extended. If you lift up the wrist with increased discomfort, particularly if you lift up the wrist against resistance and you get a lot of discomfort here, or even the finger, perhaps the middle finger, if you try to extend it against resistance and you get significant discomfort in this elbow, you may have tennis elbow. And if you're unable to get this to calm down on your own, you may desire to seek medical attention. If you see your healthcare provider, there's a few things they may consider and may suggest that you try. Of course, the tennis elbow strap, an anti-inflammatory, ice, and stretches are things you can do before you see them. But if you still have persistent symptoms, please seek out medical advice. Other options that might be considered, depending on your scenario, is a referral to physical therapy or an occupational therapist who can help you through with some exercises, stretches. They can use ultrasound and a variety of other techniques designed to help calm down that tissue. Other options could include an injection, perhaps of cortisone, which can calm it down. However, these can have adverse side effects or problems, so be sure to discuss those in detail with your healthcare provider. Other providers may offer a PRP injection. This is when a practitioner may draw some of your own blood and perhaps spin it down in a centrifuge, then injecting your own healing factors from your own blood back into that tendon, trying to stimulate a healing response. Other techniques are surgical in nature, where the tendon can be explored or debrided, or sometimes a lateral epicondylectomy where a portion of the bone is cleaned off and removed, and perhaps small holes put in the bone to stimulate a healing response, trying to bring a blood supply back into that area to stimulate healing. These may be required in your scenario to get this to resolve, although studies suggest that many times this problem can be self-limiting and resolve on its own if giving enough time and rest. However, we commonly see patients who can give this weeks, months, or even years and continue to have difficulty. So if you're having difficulty with pain at your elbow, stiffness, pain, or weakness, particularly with discomfort over the elbow, you may have tennis elbow, and we would recommend you seek medical attention and help. As always, thank you for joining us. We hope this video has been helpful. Stay safe out there, and we'll see you later. Thank you.